Eric Hammer here, registered physiotherapist. Today, I'd like to talk a little bit about movement dysfunction and the importance of really watching how somebody moves in order to establish where certain muscle discrepancies might be coming from and where somebody's pain really might be stemming from. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So essentially today, I want to talk about the idea around how individuals will develop different compensations, different movement dysfunctions as a result of perhaps a prior injury or a surgery, or just a way to compensate for their pain and just the impact and the effect that can have on somebody. So in a lot of cases, right, I'll see patients that, I like the example of the surgery, for example, where perhaps somebody has had some kind of, whether it's a hip or a knee surgery, which and they've had to have a period of time in which their weight-bearing status has been impacted. So perhaps they haven't been able to weight bear, or they've had sort of a protective weight-bearing pattern where they've had to use some sort of a gait aid, or perhaps they've been in a boot of some type, so an air cast boot, and this has really impacted the way that they move. And then once we're actually able to discharge the boot or have them weight bear as tolerated where they don't need the gait aid, we really then have to work in a lot of cases on reestablishing a proper gait pattern. And so for these patients, what you might see is a weakness in certain muscles, certain muscles that perhaps they need in order to walk appropriately, pelvic stability, glute strength. There might be some tightnesses in certain areas. So I'll see, for example, a patient might have a really tight quadricep muscle, again, as a result of weakness in the glutes. Perhaps their IT band is tight as a result of how they've had to walk. Maybe the hip's been in this sort of externally rotated position. And so I just wanted to make comment to the fact that, you know, after these particular injuries and after somebody can actually go back to, right, a proper weight-bearing status, we really have to look at how they move, and this can impact them in all sorts of ways, right? So perhaps it can create some hip pain as a result of how they're walking. Perhaps they develop some hip bursitis or some irritations along the IT band. Maybe the patient might develop some back pain as a result of some of these irritations and compensations in through the hip and the knee area. And so again, after a period of time in which somebody has been walking differently, it's going to be really important to reestablish what's referred to as a proper heel to toe gait pattern, an opportunity in which the patient is engaging those glute muscles appropriately. We want to be careful around things such as a Trendelenburg gait, where the pelvis essentially drops, right, as we accept weight on that affected side. And so again, this is where looking at somebody's gait pattern can be really important, looking at different biomechanical issues that might be going on, and then again, looking at these muscle imbalances in which certain muscles perhaps have had to work overtime as a result of this new compensation in terms of gait pattern, and others haven't worked as much. And so really reestablishing and correcting these imbalances, and then finally making sure that we're reestablishing that proper heel to toe gait pattern and any other sort of movement dysfunctions, right, that the patient might be going through as a result of these compensations. Thanks again for watching, and please feel free to leave a comment below, and please check with a physiotherapist to make sure that this information is appropriate for you. Thanks again, and have a great day. Take care.